I think what happened over the last number of days and weeks and what people saw in our emergency departments has to be a watershed moment, that we once and for all decide that we're going to put the capacity into the system and deal with the causes of what's creating the problems in our emergency departments. So firstly, we know we need more hospital capacity. We need more beds, we need more diagnostic capacity, and we need more doctors, nurses, consultants and healthcare professionals working in hospitals. So we need to put that capacity in, and we haven't done it over the last number of years. Secondly, we need a proper comprehensive workforce planning strategy. We're not training enough healthcare professionals. The Minister is almost acting as a commentator, where he's thinking out loud and saying we need to train more, but it's not happening. There has to be a much more joined up approach with the Minister for Higher Education and the Minister for Health. We have to train more healthcare professionals, and then we need to put the capacity into the community, because what's also driving what's happening in our emergency departments is we don't have the step down and recovery beds, which delays discharges, as we know, in the community. We don't have GP capacity that we need. We have people waiting days on end to see a GP. We don't have out of hours GP services. We don't have sufficient community pharmacy, and now we have a shortage of medicines on top of what's happening in the hospitals, and all of that puts additional strain on your hospitals because if people don't have those alternative care options. And all of this was entirely predictable. It was happening every year. The problem is it's just getting worse. Every winter we see things getting even worse, and it's going to continue to get worse. So that's what I'm calling on the Minister to do and calling on the political system to do. There's no point on Leo Varadkar as Taoiseach being a commentator and talking about how terrible it is in hospitals. There's no point the Minister for Health thinking out loud about what needs to be done. They're in government, they have to act, they have to put the capacity in.